So I'd like to invite Dr. Navneet Toshniwal on topics of Phaco training for the hospitals. Well, he has written a book on Phaco for those who are not aware. Fantastic books, and he's a very good teacher par excellence. He's practicing as a senior doctor in Sholapur and a good friend of mine. Over to you, Navneet.
Yeah. Slides, please.
Sorry.
Unal, na?
Thank you, Jignesh, chairperson, and all the colleagues. Dr. Gopal. The topic is Phaco training in hospital. It's a completely confused topic, and from last 25 years, I am in this process of training because the people just know I want to come, I want to refresh my hand, I want to do some cases, and I will be all right. So that too, what is the systematic way? What I have started, it may not be the different way, but what I have done, I am just presenting. This is just our hospital. This second building is just the emphasizes by the people who came for training what they need. What they need, a good hall, good OT. This is the academic hall only for that purpose in the premises. Module of teaching is completely different. In the morning, doctors are observing the cases, then they do 1-2 cases, some steps, then whole day they are not free. They are listening the lectures. I have recorded my 35 lectures on different steps of surgery, and that was also a suggestion of one of the big doctor from USA 15 years before. And they listen the lectures, watching their own cases, and then in the evening we do the analysis. Observation of the cases is the most important part. Suppose today they stuck in trench, next day they observe my cases, how I am doing trench, and the majority of the questions are over. This is the observation. Observation related to the hand movement, observation related to the angulation. Everything they will observe, and then they will ready for the hands-on. So hands-on is every day, but observation and hands-on, if just they will do come at that time and they do surgery, that will not sufficient. Lecture listening and watching their own cases, we give time for them. 2 hours, 1 hour, you have to see your case again and again. Observe your case, and then we can discuss. This is one of the most important topic. Analysis of the cases. I try to give every day 1 hour to with the doctor, with their own cases, and we analyze the cases by watch the videos. Second important thing what I am doing in my practice is the external hand movements we captured by the external cameras. The doctor is not aware of that, how he is holding the Phaco tip, how is the angulation of the Phaco tip. And all these things are very, very important to give the idea, the correlation of the incision with the instruments. Because many times phacofluidics is not working, there is a leakage like that. So analysis by photography, this is what the Jignesh has mentioned. This is my third book, Do's and Don'ts in Phaco Surgery, is just analyzed by just photograph. We take the doctor's photograph, not only video, photograph. Photograph is a still image. Now if you see the one image that suppose this left side down, my Phaco tip is over the nuclear piece. What it does? It can damage the cornea. So such a type of simple tip we try to give with the photograph. So that's the book I have written, third book, Do's and Don'ts in Phaco. Then after COVID webinars, Phaco machine discussion. After 3-4 days, we discuss the Phaco machine. I don't suggest that you take this machine. What are the features of the machine they should understand, and they should do their surgery with their own machine. That's the main motto of that. These are some of the books we have written. And recent book is on a Phaco machine. These all ideas, I am very much thankful to the doctors who came for training. They are not coming for learning, they are coming to teach me. And that's why I have written these books. And this is the way we run the Phaco training program. Thank you for your patience.
Thanks, Navneet. Well, what he has stressed upon is knowing the machine is equally important than knowing the skills. Because if you know the skills and you don't know the machine, you'll end up with more complications. So, fantastic talk as usual. A great teacher, as I just said. Thanks a lot. Yeah,
It was wonderful talk. In fact, this is need of the hour. We need to train our budding ophthalmologist, and because what is happening most of the time, they just read and they just want to perform the Phaco. I think this controlled, observational, and under the guidance training is of utmost importance, because every eye needs special care. Every eye is important. We cannot treat them like guinea pigs. So they should be initially they should be trained properly, and then only they should start performing surgeries. I think the mentorship is very important. And if you mentor one resident by one teacher, so that the teacher will be responsible and the student will also be feel attached, he can always ask question. I think this is a wonderful initiation. Being in a medical college, I don't know, sir, about you, but I have heard, just Dr. Jignesh was telling me that you are a wonderful surgeon and training, trainer. That is very nice of you.